Welcome back. If you've been struggling with constipation, bloating, reflux, or that heavy, stuck feeling after meals, you may have already come across the term methane SIBO. Maybe you've been prescribed antibiotics for SIBO or tried diet changes only to find your digestive issues just creep back in. So that's because addressing methane dominant SIBO is not as simple as one round of medication or cutting out a few foods. So today, I'm going to walk you through what really helps people find lasting relief with methane SIBO. We're going to look at the standard medical approach, where it falls short, and the comprehensive framework that we use in our practice, which involves helping you reduce the overgrowth, support motility, lower fermentation, address the gut-brain connection, uncover root causes, and finally rebuilding the gut so it's strong and resilient. And we have other pieces of information in this series, so we're going to link to those, and especially our methane SIBO diet plan. So I've put together a diet plan that gives you a list of foods that are helpful for methane SIBO because either they don't ferment, so they don't contribute to gas production, and or they support motility, and a list of foods to avoid that are going to stimulate fermentation, increase gas production, or even slow down motility. And then part of the guide also gives you a 7-day meal plan with meals and snacks. So definitely download that so you can hit the ground running with some real actionable steps and start seeing reduction in your symptoms. But today we're going to talk about comprehensive treatment of methane, and I'll get into all the things that we do in our practice to address methane overgrowth holistically, comprehensively, and naturally. So let's first talk about what's the goal of methane SIBO treatment. When it comes to methane SIBO, the main goal is pretty simple. We want to reduce the overgrowth of the methane producing microbes, the archaea that produce the methane gas, and we want to get the gut moving again because methane gas slows motility. So that's why alongside methane SIBO, we often see constipation, reflux, sometimes even nausea. And also we know that the small intestine is not clearing itself of the archaea, which continues to allow them to overgrow. And unlike hydrogen SIBO, methane is often more stubborn, which is why many people find it takes a more layered approach to fully clear it. Addressing methane SIBO usually means looking at two big targets, bringing the methane levels down and supporting the migrating motor complex. That's your gut's natural sweeping wave. It moves the food and bacteria through and out between meals so that it doesn't accumulate in the small intestine. We have that natural mechanism to help keep it clear. And that's one of the biggest problems we see with SIBO, including methane SIBO, is that motility is interfered with. So an important part of what we're doing is actionable steps to help support that cleaning wave. And that's how it helps to kind of make sure that the archaea are not reestablishing, the overgrowth is not reestablishing as we're killing it off, and also helps reduce the risk of it coming back and relapsing. Because if you've read about SIBO at all, and it's true for methane too, there's a high rate of relapse when all we do is antibiotics and we don't do anything else to address these root causes. So our kind of twofold approach is targeting clearing the methane levels and then also addressing motility. In our practice, we see that the most successful recoveries usually come from taking even a more comprehensive approach. Those would be the two factors in clearing the methane SIBO. To help with symptoms, we want to lower the fermentation because it can take, we're talking about multiple rounds of treatment. So in the meantime, we want to lower fermentation, and it largely what the diet helps with, because the fermentation is what causes the gas production. The gas is what makes you miserable. The gas is what causes bloating. The gas is what causes slowing, the constipation, the nausea. Sometimes we see belching or just that feeling of fullness. That's all from the gas production. So lowering fermentation, meaning lowering what we're feeding the microbes, lowering our intake of what they like to eat, helps with the symptoms so that you feel better while we're addressing the overgrowth. And then even working on the gut-brain connection. So that's a huge cornerstone of gut health because our brain controls how our gut functions, and different stressors in life can interfere with that messaging. So we need to support that so that naturally we are digesting our food better and moving it through at the pace that it's supposed to go through, not too fast, not too slow. So doctors may prescribe antibiotics. We may guide clients through herbal protocols that target methane overgrowth. And alongside that, we layer in motility support, diet adjustments, and lifestyle shifts to tie it all together. We also do in our practice a root cause assessment to pinpoint what created the environment in the first place that allowed bacteria to overgrow. And that could be things like digestive insufficiency, past infections, stress, certain medications, abdominal surgeries, or other imbalances that set the stage for the overgrowth. So by the end of our work together, we pinpoint the different factors that set the stage for the overgrowth. There's a lot of talk out there about root causes. I like to call them root contributors because I find that rarely is there just one thing. Usually there's a few things that kind of set the stage, set a perfect storm for SIBO to happen. So we pinpoint the different root contributors, and we put a relapse prevention plan in place to reduce the risk of relapse. And because of that comprehensive approach, we see very little recurrence in our clients compared to the typical cycle of just clearing the overgrowth with antibiotics and then relapsing 6 months later. That's super common with SIBO, but we don't see a lot of relapse in our practice when we approach SIBO comprehensively. So let's talk first about the standard medical approach for SIBO, including methane SIBO. The standard approach relies almost entirely on antibiotics. For many gastroenterologists, antibiotics, they're not just the first line approach, they're the whole game. They're going to prescribe 2 weeks. Often it's Xifaxan. Nothing against Xifaxan, it's just that Xifaxan alone is not enough to treat methane SIBO. So, but that's the standard approach these days. I am seeing more and more gastroenterologists pairing Xifaxan with metronidazole is what I see the most often. So that's really good. That's what we want to see because the Xifaxan will target the hydrogen producing bacteria. And that is an important part of it because hydrogen producing bacteria are always present alongside methane producers. And this is true whether or not hydrogen shows up on the breath test. So a lot of times we'll see elevated methane and hydrogen will be super low, and it'll look like, sometimes, not always, sometimes it'll look like a flat line, like the methane is high but straight across and the hydrogen low and straight across. It doesn't always show up on the test because often the methane producers are eating up all the hydrogen, but hydrogen producing bacteria are always present when methane producing archaea microbes are present. It's just that the methane producers are eating up the hydrogen to produce methane. So the reason I bring this up is because that is why we will always see Xifaxan paired with something else, because we do need the Xifaxan, or if we're using herbals, we have other herbs that address hydrogen producers, but we need to address hydrogen producers alongside methane producers. And what I typically see the most often is Xifaxan prescribed alone. Well, that's going to help indirectly because we're killing off some of the hydrogen producers, so they're not producing as much hydrogen to feed the archaea. But archaea don't even need a lot of hydrogen. So it really is not enough of a treatment just to slow down the feeding of the methane producers. We need either metronidazole or neomycin alongside the Xifaxan. And if we're talking about herbs, we have some different herbs, which we'll get to in a second. And even with antibiotics, the success rates are not great. So a single round of rifaximin or neomycin alone may only clear methane SIBO in about 30% of cases. And that's why most patients either don't respond fully or they feel better for a while, but they relapse quickly afterwards. And the doctor will say, well, here you go, here's the treatment. Sometimes it works, sometimes it doesn't. It might work for a while, and then we'll have to do it again in 6 months. So that's the standard approach. That's what I see the most often. One of the reasons that we see that it only mildly helps or that it is temporary is because when methane levels are significantly elevated, when they're high, it often takes more than one round, often 2 or 3 rounds to see real progress. And Dr. Alyssa Seebecker, who's one of the leading experts in SIBO and methane SIBO treatment, she often talks from her clinical experience that each round of treatment typically knocks gas levels down by about 30 parts per million on average. So that helps explain why some of those super high methane levels, like we'll see methane up over 81 often on a Genova test, because that's the highest that the test will measure. When we see methane that high, we know it's going to take 2 or 3 rounds to bring it down, because often for a constipation predominant patient, we need to get that level below 3. So we use that 30 parts per million as an estimation. And so you can see that for elevated gas levels, it's going to take multiple rounds. And 2 to 3 rounds of prescription antibiotics can be pretty hard on the body, and they're hard on the good bacteria that are in your large intestinal microbiome. And that's one reason, and that's one place where the herbal protocols can come in and be very helpful as a valuable adjunct, either if methane levels are low or moderate, maybe just going with herbs is okay. If they're severely elevated, maybe starting with the antibiotics, because those tend to work faster, and then maybe wrapping up with herbs for the second or third round, or maybe just for the third round, so that we can finish the job without being so hard on the large intestinal microbiome. So if you're wondering why are the gastroenterologists just recommending Xifaxan and why are they not pairing it with metronidazole or neomycin, because I get this question a lot. If you're telling me all this, Alyssa, why didn't my GI doctor tell me this? Because we think gastroenterologists are experts in gut health. And part of the issue, well, number one, gastroenterologists, they're diagnosing organic overt disease states that they can see when they do their scopes, their scans. SIBO is a microbiome issue. And also, SIBO is relatively new to the scene. 10 or 15 years ago, most gastroenterologists weren't even learning about it in their training. And their focus has always been on the structural or organic diseases like Crohn's, ulcerative colitis, ulcers, colon cancer, diverticulosis. So that's where their expertise shines. But when it comes to microbiome driven imbalances like SIBO, their training has actually been minimal. And that's where looking at things from a functional nutrition standpoint is really helpful, because we look at the microbiome, we look at digestive capacity, we look at motility, we look at diet, we look at the gut brain connection, we look at all of those factors that affect you from a functional standpoint and can lead to significant symptoms even when no overt disease shows up. So they might do all the tests that they have and say everything looks fine, I don't know why you're having these symptoms. And that's when we need to address it functionally. And actually, the truth is, until very recently, there weren't even widely established treatment protocols for methane SIBO. And it wasn't until 2024 when they did the ICD-10 update that SIBO and intestinal methanogen overgrowth, or EMO, were even given their own diagnostic codes. And now EMO actually has a separate diagnostic code from SIBO itself. So that step finally validated these conditions as legitimate diagnoses, but the medical system is still catching up. It can take many years for standard medicine to catch up with the newer science. So even with the codes in place, many gastroenterologists continue to fall back on the very limited antibiotic-only approach with using rifaximin by itself or pairing it with something else for methane, but just stopping there. This all reminds me of a patient I had named Sarah. She came to us struggling with severe constipation, constant bloating, acid reflux. She was having waves of nausea. And to me, it sounded like a textbook SIBO case. As I was talking through her history, I asked if she had been tested for SIBO, and she paused for a minute and then said, "That rings a bell. I think I was tested and I was told I had SIBO. They gave me the medicine for it. So yeah, that was taken care of. So what I'm experiencing now must not be SIBO. It must be something else." She couldn't remember the name of the antibiotic she had taken. She just knew they called her, "You have SIBO. We sent the prescription to the pharmacy. She picked it up. And here she was super miserable with all those methane sounding symptoms. So I had her request the actual test result. I always want to see the paper. I want to see the result. I want to see the graph. I want to see the numbers. And it came through and we looked at it, and sure enough, she was positive for methane and her numbers were sky high. And I was able to get her records. She was only prescribed the Xifaxan, the rifaximin. So I explained to her that medication did nothing to directly address your methane overgrowth. All it really did was cut back on the hydrogen, basically reducing their food supply for a short time. But since methane producers only need a tiny amount of hydrogen to survive, it didn't stop them for long. And, in cases like Sarah's, where methane levels are that elevated, one round of rifaximin alone is almost guaranteed to fail. Even if it were paired with flagyl, often more than one round is needed. And without that, patients are left in that frustrating cycle of taking antibiotics, feeling a tiny bit better, if at all, and then slipping right back into the same symptoms. It is an all too common tale, and I know that many of you listening can relate to that. While antibiotics can play a role on their own, they rarely address the full picture. And yet that's the standard approach right now. For many people with methane SIBO, that's exactly why they find themselves in this endless merry-go-round. So let's talk about our approach and what we do as a comprehensive framework for fully addressing methane SIBO in a way that lasts. Our approach looks at the full picture. Methane SIBO does not happen in a vacuum. It's stubborn because multiple factors are at play. The overgrowth itself, the slowed motility from the methane gas production, or just maybe the slow motility was a precursor that was already there, but we see slowed motility, excess fermentation, gas production, the gut-brain connection, and the landscape that allowed SIBO to develop in the first place. And if you only address one piece, it tends to come right back. So that's why at Nutrition Resolution, we use a comprehensive framework that goes step by step, reducing the overgrowth, supporting motility, lowering fermentation, working on the gut-brain connection, identifying root causes, rebuilding and healing the gut, and putting a maintenance and relapse prevention plan in place. So this way, we're not just calming the symptoms temporarily, we're addressing all the factors that make methane SIBO so chronic so that recovery is not only possible, but sustainable. So the first step is reducing the overgrowth. We're supposed to have a little bit of methane, a little bit of methane and methane producing archaea in our gut because they serve a purpose. Slowing motility down enough that you have time to digest and absorb your food is necessary, or else everything would just wash through us too quickly. So they serve a purpose. We just don't want them overgrown. So when I say our goal is to reduce the overgrowth, we want to knock levels down to normal for methane. That's below 10 in general. But if somebody's chronically constipated, we often need to get it below 3. And what we do is in our practice, we can either work with, as I mentioned, it's not that we're anti-prescription, especially if an overgrowth is super high. We might work with the client and the doctor to request a prescription so that we can make some quick progress knocking down those gas levels. But because we don't want to be on weeks and weeks and weeks of like flagyl, then follow up with herbal support to continue addressing the overgrowth. We have herbs that are just as effective as prescription for knocking down the methane producers. And those would be herbs like allicin, which is actually an extract from garlic. So we don't use whole garlic because people with SIBO are very sensitive to garlic. It triggers a lot of fermentation and symptoms. So just the allicin is the antimicrobial extract. We also use things like berberine, neem, oregano, atrantil, and we pair something that addresses hydrogen with something that addresses methane, just like they do in prescription treatment. And we do have research that shows that certain herbal supplements can be just as effective as an antibiotic for SIBO. We have research on this for hydrogen dominant overgrowth, and there's emerging evidence for methane. For example, atrantil, which is a blend of herbs, has been studied specifically for methane-related constipation and showed meaningful improvements. And we do see that in our practice. Just the other day, I had a patient with a sky high methane over 80. Last time we retested, it was about, I think, 10 or 12, 10 or 11 with just a Trantil. So we see it be very effective in practice. And we also see that Allison, for example, can make a big difference. And often these have fewer side effects and less disruption to the gut, the intestinal microbiome compared to multiple rounds of antibiotics. So this is not a quick one and done process. Depending on how elevated the methane levels are, it can take multiple rounds, whether that's pharmaceutical or herbal, to make real progress. And this is one of the reasons to use herbs in the first place. All right. And sometimes when the overgrowth starts to die off, people can feel temporarily worse before they feel better. So I like to talk about this because this is very common. It's called the Herxheimer reaction or die off, we call it. And that just means when you first start treatment, and it can be true with antibiotic or herbs, your symptoms will get a little worse before they get better. I should say they can get quite a bit worse before they get better. So we always work with our patients to first make sure we're supporting motility and detoxification, because the reason this happens is as the organisms are first dying off, a larger cascade of them is getting killed, and your body is having to detoxify the inflammatory components in those bacteria or archaea, their cell membranes, or whatever else we happen to be killing. Sometimes we're killing yeast on the side and we don't realize it. So these organisms, they release inflammatory byproducts as they're dying off, and our system has to be able to detoxify those. And if it cannot keep up, then we see a worsening in symptoms. Now, it is temporary, it's just at first. So if it's from killing off bacteria, it'll just be for a few days, up to a week. If it's yeast, it can be a bit longer. But for this reason, we always start at a low dose and build the dose up gradually. And we make sure that we're supporting motility and detoxification first to mitigate this effect. The reason I'm bringing it up in this conversation is because a lot of people they'll take something for SIBO. So maybe they'll start the antibiotic or they'll try taking one of these herbs I'm talking about, and they'll say, "Oh, I didn't tolerate that. It made me feel horrible." So they stop it, right? Makes sense to do that. But in most cases, this is why it's killing off, especially if you started at the full dose or the therapeutic dose. But it can happen even with a low dose. If you started, especially if like you're still constipated, your bowels aren't moving and all the toxins are getting killed off and just sitting in your body and recirculating, that can happen. It's important to realize that this is part of the process. It does not mean you're not tolerating those treatments. It means that we need to be careful about our dosing. We need to build it up gradually. We need to support detoxification. We need to get motility going. We need to make sure you're hydrated. You have anti-inflammatory support. There's a lot we can do to set you up for success. You can get through this die-off period and tolerate the treatment. So I just wanted to bring that up because that is so very common. Doesn't always happen, but it's very common. All right, the next thing we want to do is address small intestinal motility. We do address large intestinal motility, so let me explain the difference real quick. And when we think about the word motility, we're usually thinking about the large intestine, and we're thinking about bowel movements. So we think about motility support being like a laxative or something like that. And so when we think of it in that way, we're thinking about large intestine motility. When we're talking about SIBO, there's also small intestine motility and upper GI motility to consider, because upper GI motility, which has nothing to do with bowel movements, is slowed in most cases of SIBO. So that's the small intestine ability to clear itself, and even the stomach's ability to empty. And that's why we can sometimes see GERD or that full stomach feeling or the nausea associated with SIBO. So it's a problem of upper GI motility. We talked about the MMC earlier. So we're talking about two different things. Now, with methane SIBO, we're especially talking about both because we do need to stimulate initially the bowel movements. And I'm not a stickler on how that's done. I mean, if someone comes to me and they're regulating their bowel movements effectively with Miralax, that's cool. We'll stay on Miralax. I don't need you to be on anything different, or it doesn't have to be natural. I mean, that's fine. Miralax is very safe. So that's fine. The important thing is we have the motility going so that when we start to clear the overgrowth, we're detoxifying and your body's able to eliminate those toxins. So we do that initially, but then we also want to look at the small intestine motility piece. We want to make sure that we're stimulating the migrating motor complex, because as I mentioned earlier, that's one of the biggest problems in SIBO is for whatever reason, and there are many different reasons, the migrating motor complex is inhibited and the small intestine is not able to move food and bacteria through effectively, so it stagnates and builds up. So we want to stimulate that MMC, that cleaning wave, that upper GI motility. Now, I mentioned reasons. There's many different reasons that damage or suppression of the MMC can occur. Some of the reasons are post-infectious nerve damage. That's number one, and that happens from food poisoning. 60% of SIBO cases are triggered by food poisoning, and what happens there is there's a toxin that your body builds an antibody against. It's actually the CBT toxin that's in one of the bacteria involved in certain cases of food poisoning, and your body develops an antibody against it. And then there's a mistaken identity where your body also then develops an antibody against the vinculin cell, which is part of the MMC in the small intestine, which it thinks is similar to the CBT. So it's an autoimmune situation where your body starts attacking its own MMC fibers. And that's how that post-infectious nerve damage happens. So this is why we support small intestinal motility. And we can do that in a couple different ways. We can add a prokinetic. A prokinetic is an agent that gently stimulates motility in the small intestine. It can be natural or pharmaceutical. They're different from the agents, again, that we would use for constipation. So natural options would be things like ginger, artichoke, blends like iberogast. On the pharmaceutical side, options might include like low-dose erythromycin, low-dose naltrexone, or motegrity. Motegrity is the other one that we'll see used a lot for this purpose. We also look at meal timing, because if you're eating or you're snacking or you're even putting one M&M in your mouth, your migrating motor complex stops. So we need to make sure we're timing meals and timing even snacks or sweetened beverages, anything that has calories. We're giving enough time in between those eating sessions that we give the migrating motor complex a chance to do its job. So those are some things we do to support it. Some other causes of the suppression of the MMC would be long-term chronic stress, because the stress inhibits the connection, the vagal nerve connection, where the brain tells the gut to move food along. The brain tells the gut to stimulate the MMC, and that is pinched off with chronic stress. So we lose some of that signaling, and that can be a factor. Hypothyroidism also has a slowing effect. Diabetes affects the nerves, can affect the nerves. Abdominal surgeries that cause adhesions that make it difficult to change the structure of the intestines enough, or pull on it or tug on it in areas that food and bacteria can get caught and build up. Or certain medications that may dampen motility, like opiates, antispasmodics, or certain antidepressants. Or I should say also, we see acid suppressing medications like proton pump inhibitors or PPI that decrease your ability to kill off bacteria that you swallow. And so bacteria can come in this way, up to down, and go in that way. We want to support in Methane SIBO both large and small intestinal motility. The next thing we want to do is lower fermentation. This happens with diet support. So diet plays a very important role in Methane SIBO, not because it cures the condition. So I want to be very clear about that, is that diet is not a treatment for Methane SIBO. So even though I'm recommending you download the 7-day Methane SIBO diet plan that we have in the notes to get you started, to get you feeling better, that really is just the first step. It helps with symptom relief, helps support motility, so we can prime you for addressing the overgrowth, but then the deeper work needs to happen. But It's huge to start feeling better when you've been miserable. So, really starting with lowering fermentation through decreasing fermentable foods. That way, we decrease the fuel for gas production. It helps calm the bloating, constipation, and discomfort. And the key is that we want to do both. So, a lot of people, and there's not just one way to do things. There are a few different diets for SIBO. And for one person, one diet might work better than the next. I think typically what I've used over the years is low FODMAP, but this new kind of addition of the methane specific diet plan that I've come out with here is to help beyond FODMAP because FODMAP falls short with methane SIBO in a couple of ways. Number one, FODMAPs feed hydrogen producers. With treatment, we don't just want to use Xifaxan and just target hydrogen producers. We also need to target methane producers. So, in a similar way, the low FODMAP diet, we're not feeding the hydrogen producing bacteria, which means then they're not producing as much hydrogen to feed the methane producers, but they're still being fed because it's a low FODMAP diet. It's not a no FODMAP diet. It's not a no carb diet. So the methane producers are still getting fed. So we want to take it a bit further and also reduce resistant carbs or resistant starches because those can still be present in a low FODMAP diet. So the methane SIBO diet plan, it's low FODMAP, but it also eliminates resistant starches. And then we also want to be careful with motility because for people with methane SIBO, for people with constipation, you go on a low FODMAP diet. Now, certainly strategically, you can get all the nutrients you can get all the fiber you need if you're strategic on a low FODMAP diet. But if you're not very careful, it's very easy to not get enough fiber because we have high FODMAP foods in every plant category, and we're cutting out a lot of our typical high fiber go-tos, things like wheat bran, things like beans, lots of different fruits and vegetables and nuts. And so it's very easy to inadvertently reduce your fiber intake significantly when you go low FODMAP, which even further worsens the constipation. So the methane SIBO diet, yes, it's low FODMAP, but we're strategic about getting that fiber in so that we're supporting motility. And then also hydration is part of it as well. We did have a client recently, let's call her Anna. She told me that she didn't have bloating, which surprised me because bloating is one of the hallmark symptoms of SIBO. But when I asked about her diet, it turns out she had gradually whittled her diet down over a year to just chicken and rice and a few other like very low fiber, low FODMAP foods like green beans and carrots. When I asked her what happened if she ate something off plan, she was like, oh, yeah, well, then I'll get bloated. And this story just highlights just how effective diet can be in controlling symptoms like bloating and discomfort. Because do you have bloating is one of the kind of screening questions I ask people because bloating, although non-specific, many different things can cause bloating. It is the hallmark symptom, the main hallmark symptom of SIBO. So that's one of my screening questions. But then if someone says no, I always ask, well, what are you doing with your diet? Because if you're on a very strict diet, you can control the bloating, but that doesn't mean you don't have SIBO. That doesn't mean if you were to go eat a bunch of fermentable foods, you wouldn't have the bloating. And that was the case with Anna, but it also shows you how limiting a diet can become when you're trying to figure it out on your own. You don't know what's safe to eat and what's not safe to eat. So you whittle. Many people over restrict in this situation because they don't know what they can eat safely. So they just know that if they stick with their chicken and rice, they're safe. So that's the other benefit of having a complete meal plan, that you get a much broader idea of, okay, what can I eat? Not just what can't I eat? So our meal plan has a long list, just as long as the list of foods to avoid is the list of foods that you can eat, because we do want to emphasize that. All right, the next thing is the gut-brain connection. And this is one piece that often gets overlooked in methane SIBO treatment, definitely with the standard approach, but I would say even in general, by even practitioners that might focus more completely. So this is a big one because the nerves that control motility and digestion, they don't work in isolation. They're constantly communicating with the brain and the autonomic nervous system. And when that communication is disrupted, motility can slow down, inflammation can increase, and the whole environment of the gut shifts in a way that favors bacterial overgrowth. Stress is a big part of this picture. Chronic stress can suppress the migrating motor complex, alter stomach acid and enzyme output, decrease our output of what we need to break down food, but also bacteria that we swallow. And chronic stress also keeps the nervous system in fight or flight mode instead of rest and digest mode. So for many clients, high stress or a history of anxiety is a big piece of why their SIBO took hold in the first place and why it continues to be a problem. And this is why nervous system support is a standard part of our approach. And sometimes it's simple as breath work or mindfulness practices, either daily or even at mealtime to calm the vagus nerve and improve motility. Other times we layer in tools like gut-directed hypnotherapy, biofeedback, or vagus nerve stimulation. And when the nervous system is regulated, the gut can finally get back to doing its job, and the rest of the treatment plan works so much better. Another thing that's huge, and I would say this is probably the biggest thing I see that's overlooked or just skipped completely, is figuring out why it happened in the first place. So addressing the root cause or those root contributors. Without answering that question, it's all too easy to get stuck in the cycle of clearing and relapse. So that's why we always do a thorough root cause assessment with our clients. And there are many things that can create that landscape for SIBO. Some of the most common contributors are things like low stomach acid or digestive enzyme insufficiency, making it harder to break down food, leaving more food for microbes to ferment. Another thing is that history of food poisoning or gut infections. Remember, we talked about how that damages the nerves that drive motility in the small intestine. Chronic stress suppresses motility and shifts the nervous system out of rest and digest mode. Abdominal adhesions from past surgeries that physically impair motility and gut flow, hypothyroidism or diabetes, which are both linked to slower motility, and then the medications, the opiates, PPIs, spasmodics. Those are the biggest culprits we see. So by mapping out these underlying drivers, figuring out what's going on with you, then we can tailor a plan that not only clears the current overgrowth, but also reduces the risk of relapse. All right. And then we do a gut rebuild and heal. And this is another thing that I often see not talked about, because once the overgrowth is gone, symptoms are better, we're done, right? Well, we like to take it a step further. There's a few reasons for that. Number one, well, the reason we like to take it a step further is because in many people with SIBO, and we see this proven because in many of our clients, we also do microbiome stool testing. Many people with SIBO, their gut diversity of good bacteria is also low. There's a couple reasons for that. Number one is dietary restriction depletes good bacteria. So many people with IBS or SIBO have been avoiding high FODMAP foods, high fiber foods for months or even years to control their symptoms. But those same foods that trigger bloating are also the foods that feed beneficial bacteria in the large intestine. So while the small intestine overgrowth may calm down, the large intestine microbiome is starved at the same time. Another reason we see that low diversity of good bacteria is because antimicrobial or antibiotic treatments thin the microbiome even further. Just going through the treatment, antibiotics or herbal antimicrobials used to address SIBO affect the large intestine as well, reducing those microbial populations more broadly. So by the end of the treatment, many clients are left with a microbiome that's sparse, fragile, or full of gaps. And just like a bare garden, imagine you had a once lush garden and now it's picked over and stripped bare. So what grows the fastest when there's open space? Weeds. And the same is true in your gut. When beneficial species are missing, less favorable organisms can take over. This can lead to large intestinal dysbiosis or a large intestinal overgrowth. And that can cause digestive issues that look a lot like SIBO and can even set the stage for a relapse. We see this all the time in practice, again and again, that clients show up with either low diversity or sometimes they already have large intestinal dysbiosis right alongside SIBO. And this is why they may continue flaring even after SIBO treatment is completed and the SIBO's gone. And that's one of the reasons I like to do the SIBO breath test together with the comprehensive digestive stool analysis from the start. That lets us address everything all at once, the overgrowth in the small intestine, as well as the overgrowth in the large intestine. But this is especially why we focus on gut rebuild toward the end of our process so that we can fill in that garden with lots of lush, healthy plants and crowd out any opportunity for anything negative to overgrow. And this always reminds me of my patient, Kim. She's one of our testimonials on the website. She recorded a podcast episode, but we had worked hard to clear her SIBO, and we confirmed on retesting that it was gone, but she was still stuck on just having to eat very strictly low FODMAP. If she veered at all, like if she ate anything off plan, even just a little bit, it would trigger symptoms. So even though she was feeling better and her SIBO was cleared, she was still fragile, restricted, and constantly on that edge of being set off. So in her case, we had not started with a comprehensive digestive stool analysis. Her gastroenterologist had done a SIBO test and diagnosed her with SIBO and then referred her to me. But at this point, now that we retested, the SIBO was cleared and she was still so fragile, we ran the comprehensive digestive stool analysis. And sure enough, her large intestine was depleted of beneficial bacteria. And she was also overrun by less favorable species. So classic weeds in the garden, classic large intestinal dysbiosis. And once we addressed this with a targeted gut rebuild plan, including targeted multi-herb supplements to knock down the overgrowth, and then a full rebuild plan to build back the good bacteria, her shift was dramatic. Within just a month, she was tolerating high FODMAP foods, ones that had caused her bloating and discomfort, even in small amounts, for so long. And over the following few weeks, her sensitivity kept decreasing. She got her confidence back. Her fear of food was decreasing and she was just so much happier. She was able to go on a road trip with her girlfriends without worrying that if they stopped and ate something, it would trigger symptoms on the road. That was something she had really enjoyed that she had to stop doing until we were able to get over that hurdle. So that is one reason why looking at the large intestine in many cases, but especially why rebuilding the gut is essential after clearing SIBO. Now, in that example, she still had a large intestinal overgrowth. But let's say you clear the SIBO and you feel better and you're feeling great and you're not sensitive to foods. You could still have a depleted large intestinal microbiome for the reasons we talked about earlier, just the treatment itself, being on a limited diet so long. So we still want to do the gut rebuild, fill in that garden so your gut is resilient and healthy, because those good plants crowd out the opportunity for anything negative to overgrow. And we do that through a combination. We do the gut rebuild and repair through a combination of probiotics, prebiotics, and gut healing nutrients. And when it comes to probiotics, we're not just looking at one specific type. We use a layered approach and a person-specific approach. It might depend on strains that you're especially low in. It might depend on your full clinical picture. Like, let's say we know you have yeast alongside the issue or histamine intolerance alongside your SIBO. That might determine the different types of probiotics we use. If you have a long history of like lots of antibiotics, maybe you have lots of sinus issues in your history, you've been on lots of UTIs, you've been on a ton of antibiotics, that's going to guide how powerful and intense and which probiotics we use. Prebiotics, we incorporate these because if you think about probiotics as seeds, we need the soil, we need the prebiotics to feed this seeds so that they can proliferate and grows. And for prebiotics, those will be carefully chosen as well. And the key is to introduce them slowly, because here we're feeding organisms that we haven't fed in a long time. And if we go too fast, we can cause symptoms, we can cause gas production and bloating. So we have to ease you back into it. I always explain this like, you're not going to go in the gym and start lifting super heavy weights when you're not conditioned for it. And by the same token, we don't want to just dump a bunch of fiber or prebiotics on a gut that has not been conditioned for it. We need to start low and increase slow. And we also include gut healing nutrients. This can be things like Glutamine, especially if it's to heal the small intestine, we might think of butyrate if we're looking more to heal the large intestine, zinc, mucilaginous herbs if we're looking more at the mucus layer, immunoglobulin support like colostrum or serum derived immunoglobulin if we need more immune barrier support. So again, we personalize this to the person based on their clinical picture, and this is to help repair and strengthen the gut lining, which can often be damaged from a mucosal standpoint, not necessarily inflammation they would see in a scope, but our mucus layer and it's from a functional perspective can be damaged because the inflammation, if you think of your mucus layer, which is like in your intestines, which is where your immune system lives, it's where a lot of digestion and absorption happens. This mucus layer, if you think of it as like insulation in a ceiling or in a wall, it can have like chunks pulled out of it. Also, certain microbes can eat it up, and that can lead to leaky gut. So that's one of the things we want to heal and seal. It can also lead to irritation, just feeling more sensitive, more painful. So that's one of the things we want to heal and seal by the time we're done with all of this. And then our last part of this is maintenance and relapse prevention. Now, honestly, if we've done all of the other previous steps, there's not too much to do here because a lot of what we've done is setting you up for success. But we do want to have some support in place for whatever your root causes are and to just make sure that we maintain our results. In our practice, we bake it in. The relapse prevention is baked into the process. So by the time we're wrapping up, we've addressed root causes that created the landscape for SIBO to be in place. So, for example, if you have hypothyroidism, we want to make sure that you're working with the right doctor to have your thyroid managed. If you have diabetes, that your diabetes is managed. We coordinate care with any providers that need be. If you have adhesions, there are different modalities that can help you with the adhesion. So we might refer you out for that. Motility, we might be supporting motility. We might be helping you manage your stress with strategies to manage your stress long term. So we're putting a plan in place to help you address those root causes. We're rebuilding your gut so that your microbiome is resilient and protective, not fragile and depleted. We're strengthening motility long term. And then we're also expanding the diet because after we clear the overgrowth and we heal, we see a wider variety of food tolerance, and that also helps perpetuate a healthy, resilient microbiome because now you're able to eat a diversity of plant foods that feed those healthy microbes. So by the end of our process, each client walks away with a personalized maintenance plan. And at that point, most of our clients are able to return to a very normal diet with minimal restrictions. They're no longer stuck eating from that short list of safe foods. And this is what keeps progress sticking long after the active treatment phase is over. And it's also why our relapse rates are much lower than what's typically reported in the literature or seen with standard medical care. So instead of getting stuck in that cycle of clearing and relapsing, our clients get to move forward with confidence that their gut is stronger, more resilient, and far less likely to slip back. So thank you for sticking with us through that kind of in-depth breakdown of methane SIBO and how to really address it fully and comprehensively. In most cases, it takes more than that single round of antibiotics or a temporary diet change. It really does take a comprehensive approach that addresses motility, the overgrowth, gut rebuild, and having that relapse prevention plan in place. And when all those pieces come together, lasting relief and real gut resilience are definitely possible. So if this conversation today has resonated with you, don't miss out on the rest of our methane series. We'll link to some of our other information. We have blog posts and another recording on what is methane SIBO, and we have one about the diet as well. So make sure to check those out and make sure to download the free food list and 7-day methane SIBO diet meal plan, which is hot off the press, you guys. I just created that last month. So definitely get your hands on it. And thanks for hanging with us. I'll see you next time.